Hi, my name is Angela Wayte, and I am a public health specialist at Lewis County Public Health, and I'm here with...
Hi, I'm Steve Lyndaker, Dr. Lyndaker. I'm owner and partner of Lowville Medical Association, and I'm also a part-time medical director at Lewis County Health Systems, inpatient.
So we're going live today to talk about COVID-19 vaccines, primarily for the adult population. As we have seen since the vaccines have become available, there's been some great information going around, and there's also some misinformation as well. So the purpose of this live stream is to really answer some commonly asked questions that I know we get pretty often at Lewis County Public Health, and I'm sure Dr. Lyndaker and the physicians here get as well, and try to get some credible information out for anyone who may be considering a COVID-19 vaccine. So I guess we'll go right ahead and start. Two of the three vaccines that are currently FDA authorized are mRNA vaccines. So could you explain what an mRNA vaccine is and how does it work?
Sure. So so the Pfizer and the Moderna are both mRNA vaccines. Now, people are referring to them as a new vaccine, which is true and kind of not true at the same time. The technology for mRNA vaccination has been available now for well over a decade. It was developed actually with other coronavirus epidemics or potential epidemics, SARS and MERS. It was also developed for Ebola. There's a long reasoning behind it, but the technology, the science is not particularly new. The application to a vaccine is new, relatively, at least in this scale. So it's messenger RNA, it's mRNA, and the message is to the cells in the body to make basically a spike protein. Now, the mRNA does not go into the nucleus. It does not get incorporated in DNA. It stays in the cytoplasm. That's the kind of surrounding area outside the nucleus. And then the cells will be driven to make protein that is basically the spike protein. They then display that protein on the surface of the cell. So essentially the body's acting as its own vaccine essentially, and that's why there's such a robust response to these, because the immune system will recognize that spike protein as foreign. It will then make antibodies. It will also drive what's called cellular immunity, which are memory cells, B cells and T cells, types of lymphocytes that just sit in our bodies for extended periods of time waiting for that antigen, that virus, that pathogen to come back. And when it does, it turns on and makes antibody. So once the cell displays the antigen, the spike protein, the body's going to destroy that cell because it interprets that cell as foreign. Now, that's why you don't feel too great the next day after the immunization. Now, the good news with that is those cells that took up the mRNA vaccine are destroyed by the cell's body. There's no lingering vaccine in one's body after a couple, 3 days. It's gone. So it induces the immune response, but then it's outside, it's no longer in the body. So one thing that people talk about, and maybe I'm getting beyond here, sorry, I've got ability to talk.
I love it.
Most people know. So one thing is when we think about kind of side effects or potential drawbacks to a vaccine, we talk about kind of short-term side effects and long-term side effects. Short-term side effects are usually in the first couple days. So that's fever, chills, feeling crummy, basically having an immune response as if you had a low-grade infection. But it's protein. It's not an infective agent. That's short-term. Long-term, as we call it, is probably 6 weeks, maybe 8 weeks. So we're not talking months or years here. It's something that's relatively short-lived in terms of side effect profile from a vaccine.
Great. Yeah, you answered the second question, which would, no, that's two birds, one stone. But just to confirm, so an mRNA vaccine does not impact your DNA.
No, it gets nowhere near the nucleus or DNA. It doesn't get incorporated into any long-term reproductive or cellular activity.
Right, and I emphasize that only because it's a common question that we
For
still
sure.
get now. So
Understandable.
yes, definitely. You kind of touched on this a little bit too. So we've had, so for those that don't know, I have been at most all of our COVID-19 vaccination clinics for Lewis County Public Health. And we will occasionally get individuals that come in and they ask the nurse, I'm nervous about how this vaccine will make me feel. They're nervous about the side effects. And so you may have touched on that a bit, but what maybe, I don't know, typically is the right word,
Yeah.
but what are some common side effects that someone may experience? Because not everybody does.
Sure. So we've, some of this we're learning as we go a little bit, because early on you can kind of look at the phase 3 trials when they were, giving it to, a couple or several thousand people. But until, several million people are getting it, you don't really know what all the possibilities are. It's relatively self-limited in our experience, and certainly based on the side effect or reporting after the any kind of reaction that people have had to the virus, to the vaccine rather. And I would mention, and this I guess isn't a question, but this is the most robust follow-up and surveillance after a vaccination in the history of humankind. Like nothing has compared to this. Certainly, I've never seen it in my practice that a vaccine is being so carefully monitored. COVID arm is pretty much universal. The first or second shot is going to give you a sore arm, and often people get swollen arms and they get some lymphadenopathy, which means swollen lymph nodes on the side that you got the shot on. That means you have a good immune system. Good for you. Some people will get chills, low-grade temperature, and feel kind of crummy for the 24 hours, typically to 36 hours after getting the vaccine. Usually that will last for 12 to 24 hours, and it's like a light switch. When it goes away, it's just gone, and people feel fine. What we call malaise and fatigue. Malaise are just feeling tired. Those have really been the big ones. Now, I've noticed with some people who have, say, like fibromyalgia or rheumatologic conditions or GI conditions, I've had some people say, hey, I had a little more activity of my rheumatoid arthritis, or, I noticed a little bit more GI symptoms or something like that. Now, I'm not sure that those are related, but it's feasible that if you're really stimulating the immune system, that in theory you could stimulate it in other ways. I haven't had anyone who's had a prolonged problem after vaccination that is clearly associated. Headache, that's the other one, sorry. People have a headache often.
Sure. Yep. Good. Another question that we get quite often is, so I guess I should preface with the vaccines that we have right now in the United States are FDA authorized for emergency use. They're not FDA approved yet. A question that we get often is, what's the difference between authorized and approved, and when do we think the vaccines that are authorized will become approved?
Right. Yeah, so I'm not an expert on this, so you'll have to bear with me. But the authorization was emergency because we have a pandemic and we've lost 500,000 people. If that's not an emergency, I don't know what is. That being said, the approval process is a little bit more, I guess, time focused of sorts. And right now, the short answer to this is that my understanding is both Pfizer and Moderna have applied for approval, and they did in May and June of this year. And typically, those approvals are acted upon within 6 months. So one could probably guess, it hasn't been published or said, that by the end of the year, likely approval will occur. One thing I talk to people a fair amount about here in the office is how quickly the vaccine was developed and tested, and the science and safety that went behind it should not be construed as kind of a lackluster or rushed affair. So there's several reasons why we got the vaccine so quickly, and honestly, if you would have asked me last March or April if we would have had vaccine available, the answer would be no way, no way. But what happened was a whole bunch of things all at once. So number one, we had some of this technology from MERS and SARS. So previous corona vaccine or coronaviruses that were out there. Secondly, we had the entire genome, the whole genetic makeup of the coronavirus literally in early January. So we knew every amino acid, every sequence in that virus. That then allows for technology like the mRNA to be developed quickly. Literally within 48 hours, the researchers knew what they wanted to make. 2 days. That takes 2 years minimum for other vaccines, and that would be fast. Then, finding volunteers for vaccine trials was super easy. People were signing up like no kidding signing up, and that's almost never occurs. So phase 1, small trial, make sure it's safe. Phase 2, bigger trial, make sure it works in healthy groups. Phase 3 really opens up to virtually everyone except kids and pregnant women. The phase 3 is often very time consuming and takes a lot of effort, again, to get people to sign up. Not the case. People were signing up, and the people signing up were in areas that were having a significant outbreak in COVID-19 cases. So you put a large number of people in a trial, half think they're getting the vaccine, and they're not, half are getting it. You track those people in an area that's having epidemic COVID-19, and you get your answers very quickly whether it's effective. And that's really the reason that it went so quickly. It had nothing to do with the FDA review process, shoddy science, turning a blind eye, none of that. It's just a lot of these things all came to pass very quickly and very well. And, you know, there was a lot of energy, input, and frankly, federal money to develop that and make it happen. So that I like to reiterate with people, that just because it was done quickly doesn't mean it wasn't done well. It was done well, and it was done to the letter, no kidding, the same process that would have been done in any situation. It was just done faster.
It's a good detailed answer. I don't even think I knew all of that, so thank you.
Sometimes.
No, I like it. Okay, so we get this question often too. Sometimes things happen, somebody gets their first dose, which would be either Moderna or Pfizer, and things come up 21 days or 28 days later, they can't get the second dose for a multitude of different reasons. If that were to happen, should someone skip the second dose, or do they have to start all over again? What's the current guideline on that?
Yeah, I mean, we basically tell people to get it as soon as practical, the second dose. But, you know, we do know early on, because of supply issues, there were some countries, quite honestly, who were just doing one dose. And I think, you know, that's not where the science was. The studies were done with 2 doses, and I frankly, I commend the FDA to say, no, we're gonna, you know, do it the way the studies were done. And as it turns out, that was probably the right answer in terms of protecting against variants. So yeah, get it as soon as you can, but you don't have to start back at, you don't have to go back to ground zero. You can start at your second, you can just get the second dose.
Sure. I'm moderating comments as I'm facilitating the discussion here, and we have a comment, but I'm hoping this person is still watching and can explain a little bit more. There's a delay here, so we switch topics pretty often, so I just want to make sure I'm getting your question correct. It says, what about the J&J shot? So if you're still watching, I think it's Sadara, don't know how to pronounce your name. Can you just elaborate in your comment, and then we can answer that one at the end. Okay, will there be a booster shot? We kind of talked about this. I don't know that we have the answer to it.
Yeah, so yeah, I certainly don't have the answer. I don't think anyone knows yet. We have been very pleasantly surprised with so far the protection, both of frankly getting COVID. People seem to be protected. It looks like there's going to be a fairly long immunity to that, months, maybe years, unless there's a variant that changes dramatically. And so, I'm not saying that there won't be. The vaccinations have been pretty robust, and I think what we underestimated, or at least a lot of people underestimated, is the body's ability to really have a diverse response in terms of cellular immunity. It looks like the cellular immunity, those memory B cells, those memory T cells, are quite diversified. And one of the reasons that, especially with the mRNA viruses, but also with the J&J, we're still protected against the variants quite well, the alpha, the beta, the delta. And it's not because the vaccine was specific to those or had predicted it. It's not like the flu shot. Don't ask me flu shot questions. It's another hour and a half. But it seems as if the body's immune response is much more robust, diversified, and effective than people thought it would be. So in general, coronaviruses do not change very much. Flu viruses change in a season. We'll start with one type and move 2 or 3 different times to a totally different flu organism by the end of the flu season. That's not what coronavirus does. It doesn't change very much. So you can target vaccines that for the most part are going to be effective. Hopefully, the variants will lessen. We don't know that, but if they do, and where we are now, we're protected. So the short answer, we don't know if there's going to be a booster. There probably will need to be one at some point, but it seems as if the immune response is much more robust and longer lasting than was initially thought.
Sure. We have 2 questions that kind of go hand in hand. The questions themselves are, if I've already had COVID-19, should I still get the vaccine? And also, does getting sick with COVID-19 provide better protection than the vaccine? I think both of those are kind of similar in nature.
Oh, for sure.
Yeah.
I don't know, better, worse. I guess the answer is yes and no. So if you have COVID, you are protected quite well right now from getting COVID again. There are certainly people who've gotten COVID twice. Because of the variants are slightly different. So if you think of getting COVID, the strain that you get, you're very protected from that, but there's other strains out there that you may not be as well protected against. It seems as if getting the infection really produces a fairly diverse set of memory cells that will likely stay with us for quite some time. So the duration of that protection, albeit maybe a little more limited, seems to be very good. The vaccines so far have been highly effective at protecting against significant disease. So the honest truth is, if you get a cold, if you feel a little crummy, if you miss a day of work, we're not, as a medical community, getting all that excited about that. I mean, I bet you I haven't thought about a coronavirus for more than 5 seconds my entire career. until MERS and SARS came up, literally. It's just a head cold virus. Yeah, you got a head cold. Now, the vaccines seem to be better at protecting against the variants. So if you have both, you're like super protected, because you probably have longer term immunity than we're going to get from the vaccines, but you're also getting the benefit of the protection from the variants that the vaccine is giving us. So in some ways, you know, those are the people I consider almost like super protected, so to speak. Now I would say if you had COVID and then you get the COVID vaccine, strap in after the first shot, because you're going to feel pretty crummy the next day, for sure. And probably more so than someone who hasn't been exposed to COVID.
Yeah, we've seen that as well.
Oh yeah, yeah.
Another two questions. They're separate issues but similar. So basically people have been asking if I'm pregnant or breastfeeding, can I get it? Or if I have an underlying medical condition, can I get it?
All right, so
The vaccine.
Yeah, no, I get it. Yeah.
Just to be clear for the viewers.
So I'm an internist, so I see adults, but I don't do OBGYN. So that's my disclaimer. That being said, I can tell you that more and more OBGYNs, by far the majority now, are recommending the vaccine to pregnant patients. And the idea here is that the safety profile continues to get better. So when we're developing a vaccine, I mentioned before, we usually choose healthy volunteers first for safety. Then we choose relatively healthy people to see if it's protected. Then we open it up really to the general population. The issue is there's special populations that we do not study initially, and that's just an ethical part of medicine that has always been. That's pregnant and breastfeeding women and children under 18. So as we learn more and more about safety, and as we give more vaccinations, which, we're up to, how many, I just looked, how many million vaccines, how many do we have now? I think we're over 185 million people who've been vaccinated. Don't hold me to that, but that's the most recent one. I think are 186 million. So we have pretty good idea that this vaccination, other than what I've talked about, seems to be very safe. So once you have those sorts of numbers in terms of vaccination, then you can start to look at and trial it in younger populations. So Pfizer was already kind of 16 and older, and now we're looking at younger children, and again, pregnant women and breastfeeding women. We're starting to really develop a good number of vaccinated individuals with that. So I think the conventional wisdom is talk to your provider, learn about the risks and benefits, both of the vaccine, but I would also highly recommend you talk to your provider about the risks of getting COVID while pregnant. And there's very clearly, it's not astronomical risks, but there's clearly risks associated with it. Preterm labor is probably the most prominent that I've heard of. So that's so take that with take that as an answer from an internist on an OBGYN question. The other is immunocompromised. Certainly, I would say those are the folks that we want immunized as soon as possible. Now, the issue here is if you're on immunosuppressives, chemotherapy, etc., you may want to check with your physician, because a treating physician, so that's often an oncologist, because there's probably timing of the vaccine that may be of more benefit. So if your immune system really isn't able to mount a very good response to the vaccine, and it depends a little on where you are in your chemotherapy cycle, for instance, or getting a disease-modifying agent, an immunosuppressive, a biological suppressive, you probably want to check. And they're probably not, the vaccines are probably not as efficacious, as effective in that group, but they're certainly better than nothing. And this is the group that we worry about in terms of having severe COVID. cases. So yeah, by all means, it should be a high priority.
Sure. Now, I know you just gave the disclaimer that you are not an OBGYN. However, this has been pretty commonly asked and on social media and in general. Do we know of any fertility issues that COVID-19 vaccine may cause?
Yeah, that's there's nothing that's been published that's credible in terms of fertility. So the answer to that, as far as we know, there's not. It's certainly it's not been, it's not one of those questions that are asked like, are you trying to or thinking about becoming pregnant in the next week or 2 weeks? Or that's not a question that's being asked prior to the vaccination. So we think, as far as we know, we're not seeing any signal that there's an increase in infertility.
Sure.
That being said, we know that severe illness can certainly affect fertility. So, whether that's the flu, paraflu, COVID, other medical conditions, we know those affect fertility. There's no doubt any kind of stressor like that will. So, something to keep in mind.
Sure. This next question, I think we kind of touched on earlier, but it doesn't hurt to mention it again. This one we received through Facebook. It says, if my family and I got the J&J vaccine, should we be worried about the Delta variant? So that seems to be a common thing we're hearing lately in the news.
Yeah.
J&J may not be as effective with Delta. So what have you?
Yeah, so we did. So again, hospitalization, death. Those are what we're trying to prevent. Nuisance illness, minor illness is not all that important in the greater scheme. Probably the J&J doesn't prevent the minor illness as well as the mRNAs, but it's very effective against hospitalization and death. So I wouldn't be overly concerned, because that's really what we're trying to prevent is hospitalization and death.
Right, that severe illness.
Yes.
Another situational question. This person says they had COVID last October. They are still unable to smell and taste. They do pick up an unpleasant smell and taste of what they can only describe as exhaust when eating or smelling certain things. Is there anything that this person can do to get their senses back?
Yeah.
It's a tough one.
That is a tough one. We know that, this is a neural mediated, in other words, the nerves that go literally from your olfactory, from your smeller to your brain are affected by COVID specifically. And it interrupts that connection, and people often lose their sense of smell or taste, or they have something called taste or smell perversion, which is, I think, what they're getting at with that exhaust thing. There's certain things that just, really, you can't eat. We don't know of anything other than tincture of thyme. I've had some anecdotals, this is totally anecdotal, but I've had some people who get vaccinated, and some of the COVID side effects just go away after they get vaccinated. I've had 2 people, one who was just really fatigued, and another one who was having still some respiratory stuff. And this is weeks after COVID, like 6, 8, 10, 12, I can't remember the exact time. They got vaccinated, and it was like a light switch went off. So I know that that's happened with others. I mean, I have 2 cases in my practice. I don't know if the smell would do that or not. And then the other thing is, just keep in mind, there's other reasons that smell can be changed. So, that's more in the purview of an ear, nose, and throat doctor, ENT. So it'd be something, at this point, I would suggest at least, consultation with your physician and, maybe a little bit further evaluation, because there's other things that can do that.
Sure. Yep. Another one from Facebook. It says, now that more and more data is coming out about COVID breakthrough cases on fully vaccinated people, is there any data on people who live a healthy lifestyle, proper hygiene, supplements, and vitamins who have not taken the shot, as far as their severity of their symptoms, hospitalizations, and or death?
Yeah, so I'm not sure. It hasn't been studied in that detail. Now, all the things mentioned, generally, people who are healthier do better with any kind of infectious illness. We do know, we don't have a great predictor, but you can look at age and then significant medical issues, lung disease, heart disease, certain immunologic conditions, morbid obesity particularly, that means a body mass index above 40. Those seem to really increase one's risk of being hospitalized or getting severe illness. I can't say we've looked at that other side of the spectrum as much, but what I would say is this. There's two very basic reasons people get really sick with COVID. One is the organism itself. So the organism wreaks havoc on the body and causes organ dysfunction. Pneumonia is classic, clotting issues, clots, pulmonary embolism, kidney failure, liver failure, heart failure, it goes on and on, strokes. But there's a second mechanism, and it's the body's response to the COVID organism. So the COVID organism doesn't cause a lot of tissue damage, but the body's response to the COVID organism causes significant amount of multi-system, organ failure. So those folks, unfortunately, are often healthier people. So when you hear about someone in their 50s, weren't taking any medicines, were really quite fit, and they ended up hospitalized or worse, which unfortunately we've had a few cases in Lewis County like that. Mm-hmm. It's probably the body's response or reaction that's just so overdone that the body starts attacking itself, essentially. So it's all those things are good, but there's still, there's still risk even with that, as a baseline.
Sure. I'm going to shift over to our live stream. We have a few questions that people have asked while they've been watching. So our initial one that I had asked to elaborate has asked, is the J&J vaccine as safe as the other ones? Will I need a booster? I got really sick after the shot, but I get sick pretty easily. So is the J&J as safe as the other one, and will I need a booster?
Okay, so globally it looks like the answer is probably as safe. That being said, there's been a little bit, so the J&J in a very small number, 1 in 6 million, 1 in 2 million, it depends on who you read, who have get a low platelet count from it, and that can cause a coagulation issue. It's probably beyond, frankly, it's not all that well understood, but it can cause clotting, and it can cause this really rare type of clotting called a sagittal sinus or a brain thrombosis, which just means clot. Mm-hmm. We use words that no one else uses. Keeps us in business. So it's rare, but it's identified. It's probably in middle-aged women, we think, because those have been more the cases. It's, relatively, this is rare, but it seems to be possible. There's also some suggestion that the mRNAs can cause some mild irritation or inflammation of the heart. Mm-hmm. Now we know in kids who get COVID, they can definitely get some heart issues, inflammation, some fairly significant things, albeit, thank God, rare, like really rare, but possible. So again, it's a little bit poorly understood. The vaccine-related inflammation of the heart, and this is probably a question more for my wife because it's more in children. Mm-hmm. But that seems to be mild and self-limited, but it's being recognized. And again, this surveillance after vaccinations is like none other that we've ever experienced in this country in terms of surveillance for side effects or possible problems.
Sure.
You have to keep in mind that the scientists, so to speak, right? The doctors, the nurses. I mean, we all have families, right? We all are part of this community. We're neighbors. We're not, we're human beings just like everybody else. So I feel like, I'm not trying to sell a bill of goods that, just because somehow there's this conspiracy out there about, trying to force a vaccine or, that's just, I'd ask everyone just to take a couple steps back and just think about this more globally. I mean, I have a vested interest in this community to be healthy, as, we all do. So, that, I think sometimes you just have to bring the temperature down a little bit and just understand that we're trying to do what we feel is best. And, and walking the walk and talking the talk. All my kids are vaccinated. They're older, 15 and older. But, it's something I feel strongly about. So, it's just getting that perspective that, we want to do the right things for the right reasons. So that's, part of the reason I'm doing this today, honestly.
Sure. Another question we've received, is there a certain blood type that is more apt to getting COVID or not?
We don't think so.
Okay.
No.
Okay. What if someone had the Johnson & Johnson vaccine? Should they now get a second vaccination, either Moderna or Pfizer? There is talk that the J&J is not as effective against the variants.
Yeah. Right now, the answer is probably no. That may change. That's a little past my pay grade.
Sure.
Because it would be outside kind of the FDA authorization. But there is talk about potentially supplementing in the future. But I'm not sure.
But as of today,
It's
no.
no.
It's a no.
Yeah.
Yep. Okay. Getting COVID-19 twice, is that any different than getting COVID after being fully vaccinated? You don't hear a lot about getting COVID twice.
Yeah.
Not too often anyway.
Yeah. I'm not sure. We know that after getting vaccinated, you've got about a 4 or 5% chance. Although that was people who were getting tested like routinely after the second vaccination, many of whom were asymptomatic. I would assume that if someone gets COVID twice, they're sick twice. So I know of 2 people who've gotten COVID twice. I know of no one who's gotten the vaccine who's gotten COVID. That's just my little world.
Right.
But I'm not sure we have good data on if you have COVID, how protected are you?
Right.
I'm just not sure that if that data is published, I don't know what it is.
Sure. Yep. And then this is the last question that I can see so far. Who knows? I'll check again before we conclude. Also, what might be the reason behind the deaths of those who died after getting a vaccine? There could be many.
Yeah, so that's a loaded question. I think, so we vaccinated 186 million people in this country. We started with the most vulnerable. So people are going to get vaccinated, and people are also going to have strokes and heart attacks and motor vehicle accidents and all the other things that we would expect. So really what you do, this is in the weeds a little bit. And Ashley probably could do better at this with her public health background. But we look at something called excess deaths. And this usually comes out of actually flu season. So every flu season, we record as best we can flu-related deaths. It's often not the primary reason for death. It's often like acute kidney failure or complicated pneumonia. But as a contributing or as a secondary or tertiary, it started when someone got influenza. So we capture as best we can the number of people who have associated influenza-related deaths, or even influenza as the primary. The same would be true for COVID. So we try to capture COVID-related deaths, either primary, secondary, tertiary, or as a contributing factor. Those all count in the numbers epidemiologically. Different states do it a little bit differently. I don't really understand that.
Mm-hmm.
Now, what we look at really, and I'll go back to flu season, is something called excess deaths. So during the flu season, we expect 100,000 deaths in a patient, in a population. That population, though, there was 125,000 deaths. Well, where did those 25,000 deaths come from that are unaccounted or statistically outside what we would have predicted? Often the epidemiologists will say some of that 25,000 excess may have been related to influenza. So we have a way of kind of statistically looking at and predicting population death rates. That's what actuaries do. I don't know if anyone knows an actuary, but they work for insurance companies. They are the smartest people I have ever met in my life. And they predict mortality risk statistically. So, long answer, when we look at people vaccinated for COVID, we see no excess death in that group. So people get vaccinated, people get issues that they're going to get, and those two don't necessarily have to be related. So if 186 million people got the vaccine, some of those people are going to die the day of the vaccine, the day after the vaccine, a week, a month, 6 weeks. The key, though, is it in excess? Does it look like it is over and above what we would predict for that population? And the answer's been uniformly, resoundingly, no. And again, that's something that's being tracked very, very closely. And if anything, this is another thing that drives me crazy. If anything, we are underestimating the number of COVID-related deaths. We're not overestimating it. It's the same as that happens in flu season. We're probably missing some of those. And then often at the end of the year, they make up a statistical difference. The same thing is true for COVID. We're underestimating COVID-related deaths, not overestimating. And we have no vested interest financially or whatever to under or over report. It's, we're just trying to put down cause of death. That's, how we fill out death certificates as accurately as we can.
Right. Those are all the questions that I can see for now. Of course, if any come in, maybe you're not watching this live, you're watching it later, you can feel free to ask. We at Public Health can try to answer those, or if we need to consult, we can consult and we can, get an accurate answer for you there. Because this is a COVID-19 vaccine Q&A, I did want to mention a couple of clinics that Lewis County Public Health has coming up. We have walk-in clinics this week at the Lewis County Fair. So if you go to the fair, you can find the emergency management trailer. It's by the Bostwick Street entrance. We have a nurse there who is equipped with the Johnson & Johnson vaccine. If you're unfamiliar, it's a one-dose vaccine. And that was part of the reason as to why we chose that vaccine for the fair. It's a one dose. We don't have to worry about scheduling you to come into the office for a second dose. It's just one and you're done. So that's available today through Friday from noon to 7. So feel free to, you just walk up. You don't have to make an appointment. You can just let them know I would like a vaccine and they will get you taken care of. If you are looking for Pfizer, for us, we are having a drive-through clinic that's going to happen on July 30th at the Lyons Falls Bible Fellowship Church from 2:30 to 5 o'clock. So you stay in your car, you drive up, you'll get your vaccine, you'll wait your 15 to 30 minutes depending on medical history, and off you go. You come back 21 days later to the same location at the same time and you'll get your second dose and you'll be done. If we happen to have any students going back to school, because it's July 30th, by the time you get your second dose and then that 2-week period following, you would be considered fully vaccinated by the time you return to school in the fall. So that may be a benefit for some. Those are all the clinics that we have scheduled to date. Future clinics would be posted on www.lewiscounty.org. You can also call us at 376-5453, and we can give you information that way. We are also not the only organization giving vaccine. I believe you can go to vaccinefinder.org. You type in your zip code. Many pharmacies nowadays have it, and even then you don't really have to schedule an appointment depending on the pharmacy. I believe I was just at Walmart the other day and it said walk in, so you can walk up, ask, and you can get the vaccine, no problem. Do you have any final remarks before we conclude?
No, just not really. I appreciate the time.
Thank you.
I guess what I would say is, as much of the science as we know is kind of published and available. We've certainly spent a lot of time talking about the nuances, and honestly, some of this stuff really pushes the border of what we know to be true. But what we do know to be true, no kidding, is that it's highly effective. The reason that we're seeing absolutely plummeting numbers, much, much, much lower numbers of COVID in this country, is the fact that over half the population is vaccinated. That's the answer. There's nothing else that is accounting for that, period. It's not, taking ivermectin or Z-Pak or coenzyme Q10 or vitamin D or any of that stuff. That's not why. It's not like all of a sudden people are doing that and it's working. It's because the vaccine works. So that to me should be evidence enough that it's effective. The safety, as I said, there's never been a vaccine that's been surveilled like this one. And I am confident that these vaccines are highly safe and can be used in almost any patient population. Lastly, I think the population we're struggling with is, the 20 to 40 who are healthy. I get it. You're likely statistically not going to run into trouble. But I can tell you, my daughter is a fourth-year medical student at University of Rochester, and she was just in the pediatric intensive care unit. And over the course of that six-week rotation, over half a dozen kids came in with complicated COVID, like no kidding, and these were healthy kids. So it's not that it doesn't happen, it just doesn't happen very often, but it's unnecessary. I spend my day trying to keep people as healthy as I can, but there's a lot of things that I can't treat and I can't prevent. This is something that we can prevent. And when I see someone hospitalized or even, or more significantly ill from COVID, it's like a kick in the stomach. I mean, it's just, it really, affects me very deeply because I know that there was something available that could have relieved that pain and suffering for both the individual and the family. So, it's not a scare tactic, I hope it isn't, but it's just kind of that personal appeal. So, obviously people can do what they want, but I'd ask you to really, strongly consider for yourself and really for your family as well, just in your neighbors. The more people vaccinated, the fewer variants we're going to have, the healthier community. The more, hopefully the quicker we can get back to normality. So please consider that, really do.
Well, thank you for taking time out of your busy day, and also thank you to Nick from Linking Lewis County for being willing to live stream the event. Like I said before, if you have questions later on, leave them and we'll try to get back to you as soon as we can. Thank you so much for watching and have a good night. Thank you.